This is Dr. Seth Gamrad from USC presenting reverse shoulder augmented glenoid baseplate technique. I am a consultant for Zimmer Biomet. Exposure is critical. Deltoid release, osteophyte resection, capsular release on both the humerus and the glenoid, but most importantly, a large head cut facilitates this procedure. The augmented baseplate comes in three sizes, 10, 20, and 30 degrees, and can be used posteriorly, anteriorly, but more commonly superiorly. It's fixed with 4 locking screws and a central compression screw. The first step is to place a pin, ream the glenoid to 50%. Third step is to choose the augment size and orientation. Then we like to drill a positioning hole. The next step is to place the augment reamer guide, followed by reaming the low side of the glenoid, trialing the augmented baseplate, and then finally impaction of the press fit augmented baseplate. So first we're getting our exposure here. I like an anterior Batman or flexible 2-prong glenoid retractor, a posterior as well, and a posterior-superior sharp Homan. You can see we've got great exposure of the glenoid. As mentioned, it helps to have a great head cut and capsular release. So once we have this exposure, on the right of the screen here is posteriorly, on the left is anteriorly. Then we're going to take our first guide. This is a guide that's going to place the pin low center in the glenoid with 10 degrees of inferior tilt. Then we can use this sizing guide to choose the size of our augment. What I'm doing here now is marking the 50% point of our glenoid, so we know when our reamer comes down to that spot, we're done reaming the lower half of our glenoid. So standard reamer here, bringing it down until I touch those 2 black lines on the mid portion of my glenoid. At this point, you may see a little bit of cancellous bone, and that guide again checks and makes sure that you are flush and that you've reamed enough inferiorly prior to reaming the augment. All right, the next step is to place the orientation hole. This is going to lock in the orientation for your augmented base plate for the rest of the case. Just a small drill. So now there's 2 points of fixation. Now this is the reaming guide to ream the low side of the glenoid, in this case superiorly. So we place that in. Guide pin can then come out. Sometimes an impactor is necessary to get that all the way down flush. And then what we're going to do next is fix that reaming guide with a central set screw. This is going to hold the guide firmly in place while we ream. What that does is it's going to block the inferior bone from being reamed anymore. This little black bushing protects the guide while we ream. And then here's the reamer. It's a small propeller-shaped reamer, and it's going to ream down the upper portion of the glenoid, what we're calling the low side, where the augment is going to go. So we've reamed that. Now the set screw can come out. And then we can extract the reaming guide. And the next step is to check and make sure that we've reamed it properly. This is just a 10-degree augment here we're using, and you can see that fits nice and flush. Now here comes the augmented glenoid baseplate. We place the orientation correctly based on that second hole inferiorly in the glenoid, and then impact it into place solidly. And this should have an excellent press fit before any screws go in. After this, it's just standard baseplate preparation. Central compression screw. This is 30 millimeters in length. And then 4 peripheral locking screws, bicortical. These are all angled 10 degrees outward. I usually place these 90% of the way in on power and then finish them by hand. Typically the superior and inferior screws are going to be 25 to 30 millimeters, and the anterior and posterior screws are going to be 15 to 20. This is very important. You can choose 1.5, 2.5, or 3.5 millimeters of offset with this system. I'm marking the degree and direction of offset here. I've chosen 1.5 since we've got a nice low placement of our glenoid base plate. Then we're going to really clean out our Morse taper. Dry the central hole. And then insert the glenosphere in standard fashion. I like to hit it in with the inserter and then give it a couple more wraps with this instrument here, the glenosphere impactor. Then we can place our trial. Some number 5 ethibonds for the subscapularis. I like to use micro stems in primary cases. Impact the stem, retrial, place the definitive metaphyseal component, and then reduce, take it through a range of motion, make sure that there's no impingement. Thank you.